G'day, and welcome to Dental Direct. In today's video, we'll be focusing on an intro into endodontics. Let's begin by asking, what is endodontics? As defined by the New Zealand Society of Endodontists, endodontics is a branch of dentistry concerned with the morphology, physiology, and pathology of the human dental pulp and periradicular tissues. The study and practice of endodontics includes the biology of the normal pulp and periradicular tissues, and the etiology, prevention, diagnosis, and treatment of disease and injuries that affect these tissues. In more simplified terms, endodontists are the dental specialists of the pulp. Endodontics focuses on everything involving the pulp. So you may be wondering, why is it that there's an entire specialist branch of dentistry devoted to a seemingly not so complicated component of the tooth? Well, as we continue on with the series, they'll become more evident and you'll hopefully gain a better understanding of what endodontics really is. So to begin, let's review what normal pulpal anatomy looks like in a tooth. So this is a simplified cross-sectional diagram representing what the tooth pulp normally looks like. At the most coronal part of the pulp, we have the pulp horns, with a supporting chamber called the pulp chamber. The root canals run through the apical portion of the tooth, through the roots of the tooth. These canals act as communications for the nerves and blood vessels to run through and supply the pulp and the cells of the pulp. This is a picture of the root apex, which would be in the apical or lower third of the tooth. They would be connected to bone and would have a canal running through it to allow blood vessels and nerves to reach the pulp. This becomes important later because we want an apical constriction when we do root canal therapy. This apical constriction will act as a plug for us to have something to push against when we are using the filling material in a root canal therapy. We call the sealing and filling of a cleaned and shaped canal obturation. So the apical constriction becomes very important during obturation, and we want to prepare that before obturation is occurring. That's why the leading up steps are quite important. The distance between the apical constriction and the apical foramen is approximately between 0.5 and 1 mm, with the apical foramen having an opening of about 0.3 to 0.6 mm in diameter. This depends on what tooth you're working on, as well as any anatomical variations your patient may have, and of course what your dental school and textbook tells you. Looking at some related features, the pulp will be filled with blood vessels, nerves, and other dental cells, like odontoblasts. Odontoblasts are of course the dentine-making cells, and they line the pulp wall. The important thing here is that they make or secrete dentine throughout the entire life of the tooth. So when you're looking at an elderly patient, they'll have a small pulp with a thick dentine layer. When you're doing restorations, this means you can go a little bit deeper than you normally would for a child or adolescent patient. Because younger patients have less dentine made by their odontoblasts than older patients. A rough estimate would be that the pulp shrinks by 25% from 20 years of age to 60 years of age. We'll go into more comprehensive anatomy in a later video. But for this introductory lesson, we'll just move on to some pathology. Now that we have the basic idea of what normal looks like, let's look at some abnormal. In this circumstance, the pulp is being used as a very useful diagnostic indicator of a carious disease process being present. Now, we don't necessarily have a guarantee that this is current active caries. It could possibly be arrested and the pulp could be in a state of healing, but we would definitely be concerned in comparing the tooth to an old X-ray. Old X-rays will help give us an idea whether the disease process is arrested or progressing. When the tooth structure especially dentine, becomes infected from bacterial invasion, tertiary dentine is deposited to combat the invading microbes. It's simply the tooth or the body's response to invading organisms. We can see this in the photograph, that the pulp horns are not at equal heights to each other. And we could compare this pulp to an adjacent teeth's pulp. We would see that the pulp is lower in comparison to adjacent teeth, so this would indicate disease to us. Clinically, we can describe this as pulpal horn recession. When we look at this image, and we assume that the radiolucency we see on the first molar is a carious lesion, we would immediately be worried about hitting the pulp if we were to do a restoration. There isn't a lot of room to drill tooth structure out. Just from doing a simple visual examination, it is possible that most of the occlusal surface is present, and possibly this large radiolucency is just coming from a small access cavity. But being aware about the pulp and any implications our restoration would have prevented us from drilling into the pulp. So before we dive any deeper into endodontics, I'm going to stop it here. This was quite a simple video, but I wanted to make sure we're all on the same page moving forward. I'll go into more specific detail in a later video, but until then, thanks for joining us in this video from Dental Direct. In the meantime, protect that smile and live a healthy lifestyle.